Welcome to the Modern Reset. I'd like to take you through a quick presentation on what the main goals are for clients, who's a good candidate, who may not be a good candidate, and how this whole program may work to benefit you on your health and wellness journey. This customized program that I've designed over the past 15 years integrates Western medicine along with wellness and integrated medicine for a more functional and holistic approach. By using evidence-based approaches, comprehensive evaluation and lab testing, we're able, we feel, to help tackle and pinpoint what deficiencies clients may have as they go through their individual journeys on optimizing their wellness. Let's go through the basic pillars, and hopefully all of your common asked questions will be addressed, and we look forward to chatting with you more after this presentation. Let's get started. Here's the basic outline that we talked about. The goals of the Modern Reset can be described in very simple terms, basically to increase your energy and sense of well-being. A lot of us are just busy and tired, managing our stressful lives of work, family or personal obligations, and so we find that we neglect ourselves, and as a result, with aging on top of the lifestyle, we're finding that basic factors are missed in general health physicals through insurance, hence the need for a customized and individualized model that we've designed here. I've graduated with a degree in exercise physiology, studied medicine at top caliber universities, and have completed residency training in UCLA/Kaiser, and have been working in private practice for over 15 years. The Modern Reset program has really stemmed from the very beginning when I was an undergraduate student, as I wanted to focus on what factors were important for us to have true health and wellness from the inside. And ultimately, here I find myself recommending basic principles with more of a modern and comprehensive approach. And thanks to the advances in science, there's a lot of amazing tools that we have at our disposal now. What makes this Modern Reset unique? Well, we're able to comprehensively focus on wellness, looking at a systems-based approach. The program is led by myself. It's a physician-led program with certification and attention to detail. The comprehensive lab testing is able to be interpreted, and a treatment plan can be customized for clients so that you really have someone as a partner on your side as you go through this journey. Suitable candidates for the health and wellness program are those that do not have any serious medical conditions, nothing that actively, such as cancer, uncontrolled diabetes, or serious medical issues that warrant the care of a primary care or a specialist team currently. Those that are not suitable for the wellness program obviously are individuals that have symptoms or things that are not in their favor. And if your general health is fair or below fair to poor, we would not recommend you continue with this program. The basic pillars to health and wellness can be shown here. We truly feel that an integrated approach is what makes the Modern Reset have a true value. Not only is sleep important, it's vital and fundamental to having a good outcome. Energy will only arise if true sleep quality is there. There are factors between our mind and the body, our psychosocial factors, our relationships, nutrition, activity, hormonal balance, and cellular health are all going to play an impact on how we feel and function. The body can be very complex, but by taking a basic approach, going through step-by-step systems, we're able to optimize health for most individuals, as can be shown here. Looking at inflammation as shown by the pancreas, in relation to the adrenals that produce cortisol, and that then affects the thyroid, and then can affect sex hormones such as estrogen, testosterone, progesterone. The basic pathways can start to be understood, and the relative effects can be then defined, and treatment plans can be delineated for clients based on a very simple approach. Sleep can have many variabilities behind it. Not to go through all of these details, but sleep can be more complex than we take for granted. So oftentimes I recommend clients perform a sleep study, and sleep study can be done in the convenience of your own home. Based on the assessment that we perform, we're able to recommend if this is important or not, usually. Unfortunately, since a lot of sleeping disorders are underdiagnosed, a sleep study is usually in the best interests of you. Thankfully, there's many treatment options out there to help sleeping disorders, and rather than just taking an extra melatonin or taking a supplement over the counter or a gummy, there's true medical science that is natural based and can be effective and safe in the long term. Hormonal balance is something that affects all of us as we age. Men go through andropause, women go through menopause. And so what's funny here is that often times men and women underreport their symptoms, and they just think that this should be taken for granted and is part of natural aging. But with the lab testing that we perform and the customized approach, we're able to pinpoint deficiencies or relative excesses of these hormonal balances and create a unique treatment plan that can then counterbalance anything that may be off. This pathway is obviously not something I want you to memorize, but it just shows the basic complexity of the hormonal production in men and women. And by understanding this pathway, we can appreciate the context and the value of not starting people on things like testosterone or estrogen creams, because we want to understand what the other pathways and the relative effects of cortisol and insulin are doing. So we really want to look at things in the big picture, not just the details. And the basic analogy is to look at the forest and look at all of the trees, and then to dive into the forest and identify the basic things in terms of each tree itself. Here's another graph, to explain the pathways and how progesterone and estrogens and testosterone are all connected. So what we'd like to do is go through a step-by-step approach. We like to do a complete lab assessment that would then integrate with your assessment in person. Oh, sorry, scratch that, sorry. I don't know why they did that. Okay. Just rewind like 10 seconds. Right. So the evaluation, of course, is individualized for all clients that walk in. So we would like to do a complete lab assessment, and then we integrate that. And if there's anything that we need to assess specifically, we'll be doing specialized lab testing and discussing treatment plans thereafter. Some of the basic things that we use in our programs can include peptides. And peptides have a wonderful range of benefits depending on the individual that we're using them for. Growth hormone is something that men and women naturally produce over time, and we lose over time. Thankfully, there are peptides that can improve the natural production of our growth hormone. Appetite control, sexual health, male and female energy can also be stimulated and supported through peptides. When we look at the mind and body connection, we do care about the effects outside of the realm of traditional medicine. And by understanding the impact of these and realizing that stress truly does have a physiological impact on our function at a cellular level, we want to recognize these stresses and create a more of an adaptive and resilient system in the body. Various methods that are recommended may include biofeedback, meditation, deep breathing, acupuncture, yoga, and journaling, and so on. But also supplements can be quite useful, and we like to customize these as clients have seen in our office. Mind to cell connection is quite proven, and studies have shown that mental stress can cause inflammation at a cellular level. Supplements and nutrition obviously are very confusing for most of us, and there's a lot of evidence out there that can guide people in one direction or another. The general approach is that we take at the Modern Reset is we want to make sure that inflammation in the body is low and metabolism is in an optimal state based on the stage of change that you're at. And oftentimes during the journeys that we take clients on, we go through different phases, and we can adjust the nutrition, the training, and the supplement plan to match their different needs at different times. A lot of clients complain about gut imbalances, and the gut imbalances can be described very well through a functional gut health evaluation, such as sensitivity testing and permeability. A lot of us may have heard of leaky gut syndrome. Leaky gut syndrome can be caused by many systemic factors and internal factors as well. And unfortunately, this is underdiagnosed, we find, and undertreated, and can have a big systemic effect on the rest of the function of the body, particularly energy. There are many studies, even dating back to an article by the CDC, that discusses the pathways of inflammation in the body. And I want you to pay attention to the connection between insulin resistance and disease. Inflammation we commonly think of as a swollen toe or something that's visible and red and warm and hot, but that's external inflammation in the soft tissue. Inflammation can also happen at a cellular level, and we call this metainflammation. This metainflammation comes from oxidative stress And unfortunately, this is what leads to suboptimal function of cells and then systems and then chronic disease. And we can pick up on these imbalances at an early stage through advanced lab testing and a customized approach. Cortisol rhythm, something that our body naturally makes throughout the day, can diminish or be negatively impacted over time. A healthy person will produce some cortisol in the morning and reduce its release throughout the day as they go to sleep. Some people just do not produce enough, and many actually, will produce too much throughout the day for obvious reasons. And so we like to balance this, and if we do not balance this, we're not able to control the other pathways in the body and then therefore reduce the other dysfunction and wellness that we're trying to go for. Here is a proven pathway between cortisol, inflammation with insulin resistance, and the relative connection between how the liver manages the blood sugar and the fat tissue in our body. And these systems all work together, and it may be a positive or it may be a negative relationship. Obviously, you're going to optimize the relationship between all of these systems. A lot of clients may be watching this video because of the craze for semaglutide. We believe semaglutide in a nutshell is valuable for the right individual, and after doing a comprehensive evaluation and lab testing, we're able to recommend this for clients or not recommend it. But semaglutide has helped clients in our office lose over 20 to 30 pounds quite consistently when used appropriately. There are reasons why we will not recommend it as well. Generally, if you have more than 20 pounds to lose, semaglutide is helpful for the first 10 to 15, and there's more finer tuning methods to help reduce the last 5 to 10 stubborn pounds. Semaglutide versus tirzepatide, there are several differences. Tirzepatide has a dual mechanism, semaglutide has a single mechanism. All right, there's a slight cost difference. The dosing is still once a week in terms of its administration, and clients may notice benefits from one versus the other, but we can discuss which one may work best for you after an assessment. Several supplements that we like to recommend may include carnitine, serotonin boosters, glutamine for gut health, and other fiber-based supplements, metabolism-based supplements, and various other factors to help boost the various deficiencies and pathways that we all need for optimal energy. Indications for optimal exercise can vary. Oftentimes we find people are exercising too much, and we have to mitigate the amount of exercise they're doing or change it from more of a stressful environment of exercise to more of a restorative environment. But in terms of using an exercise-graded training program, we're happy to give you specifics in terms of details and help you understand what may help your body get the best results. So in summary, we believe the body can be maintained like this beautiful garden over 100 years old. We want you to be in good health and have an optimal sense of well-being on your journey. Thank you.